It's all in your head. You don't look sick. Your tests are normal. It's probably anxiety. There's nothing wrong with you. Have you heard these words from physicians, family, and friends? If you're someone who has been struggling and swirling through the revolving door of healthcare to find answers about your health, or if you know someone who is going through this experience, then this podcast is for you. Welcome to the Desperate for a Diagnosis podcast with Laura Nozicka, a show dedicated to exploring the challenges of living with undiagnosed or rare medical conditions. This podcast explores both sides of the bedside. We will be speaking with patients who have had challenges with finding a diagnosis, along with experts in the field. I'm your host, Laura Nozicka. Please note I am not a medical professional, nor am I affiliated with any healthcare, pharmaceutical, or device company. I am an entrepreneur, and I am an independent market researcher focused on helping healthcare organizations better understand the patient perspective. The podcast is not meant to offer medical advice, but to merely share the stories and perspectives of podcast guests. Hello, and welcome to the Desperate for a Diagnosis podcast. I am your host, Laura Nozicka, and we have a very special episode today. They're all special, but this one in particular is unique in that I have two guests who have come back to speak with us today, and these ladies, young ladies, are incredible. They're doing amazing things. And when we talk about silver linings, they are bringing the silver linings to the forefront here in their young lives. And I'd like to welcome back Emma Smith and Olivia Goodrow. Thank you so much, ladies, for being here.
Thank you so much for having us on.
Yeah, thank you so much.
Yeah, it's great to see you both back. And just to give everyone a little bit of a quick recap, Emma was on the show not too long ago, and she was walking us through her experiences with her journey with long COVID, which she still continues to contend with, but is getting better, and happy to hear that she's made progress, but still going through the journey. Not everything has been resolved at this point, but I encourage everyone to go back to her episode and learn more about her experiences. And then Olivia, who, oh my gosh, Olivia, I think we recorded right before you started school, I think. Yeah, so it's been a while, and Olivia told us all about her journey with being diagnosed with Lyme disease and other tick-borne illnesses, and all that she's been doing ever since, and what that experience drove for her in terms of the silver linings. But I'd like to welcome both of you back. So thanks so much for being here. And I'd like both of you to just give a little bit of introduction about you from a standpoint of what you've been up to since we last talked, and what you're involved in, and school and jobs and things like that. So Olivia, I'm going to start with you since it's been a while. What has been happening with you? I know you've been doing a lot. I've been trying to follow you as best as possible, and in contact with your mom, because she's really good about keeping your schedule and keeping things on track. So what has been happening with you?
Yeah, so a lot has been happening recently. I am still running my nonprofit, the Live Lyme Foundation, which we talked about in the last episode, and with Tick Tracker and the Long Haul Tracker. And I've still been doing a lot of activism around the country, which has been very nice. However, I am now a student at UCLA, and yes, it's super exciting. And I've been pursuing a degree in public health, and this was just my first year. I finished it a couple of days ago. And that has been absolutely incredible. And the reason why I am able to go to California and be able to go to college is because I'm now in remission due to a dapsone treatment that I did last January, which I can talk about more. But yeah, it's been very fun, and I'm on the upturn, and it's been great. So it's really nice.
What's your favorite thing about college, freshman year? What's your favorite thing?
My goodness. Wow, that's hard to say. I mean, UCLA so incredible. I tell people that if I got into Harvard tomorrow, I wouldn't want to go. I think that at UCLA, there are so many equally talented people who are passionate about a wide variety of things, and everyone at UCLA they have done something incredible or are doing something incredible. So it's very nice to be surrounded by people who want to grow with you and want to encourage you to be better. And it's been really incredible meeting all of these new people.
Yeah, and it went by fast. I'm sure it went by fast for you, but when I was talking with your mom and she said you were doing exams and all these things, and I thought, oh my gosh, that went by so fast.
Super fast, but very fun.
Yeah, yeah, terrific. Emma, I know we talked just a bit ago, but I think you celebrated a birthday recently, right?
I did, yes. I turned 26 on June 9th, which felt very surreal. And yeah, I mean, I came home when I was, oh my gosh, like 23, 24. So the fact that it's been 2 years is kind of insane to me. But yeah, so I'm 26. I figured out health insurance because I just got put off my parents' health insurance plan, which is okay. I figured it out. But yeah, so
you know what that's called now, Emma, don't you?
what is that
Called
called?
adulting.
Yeah, yeah,
That's
it's
official.
true. It just
You're
hits you real
welcome.
hard in the face. It's awesome. So yeah, so just turned 26. I just got my first job in 2 years, which feels monumental. I forgot how much I missed working. I'm creating content regarding vaccine and health equity for a youth media organization based in New Mexico, which I'm absolutely loving. And it's very part-time and it's remote and the hours are very flexible. So I can kind of manage my fatigue while also, you know, doing work that I love and learning a lot and then also getting paid, which feels great. And then my two friends and I are still working on launching our nonprofit called thThe, with the goal of just helping other long haulers or people with chronic fatigue syndrome rethink recovery and then just regain and hopefully resume back to their normal life with enough time. So yes, we're working on that. And we just designed the logo and launched the Instagram. So that's been really exciting. And yes.
Nice. Well, I see a lot of similarities between you two ladies from your activism standpoint and in your interest in public health and health equity. So I don't know, down the road, I might see some collaborating among both of you. And I know, Olivia, you and your family, you have a history of service in different service organizations that you've been involved in or started. Is that right, if I remember that correctly?
Yes, my family has loved starting nonprofits to help other people.
Yeah. So maybe one day you and Emma could have a little chit chat and talk about what that's all about. So very, very cool that you have such great things going on. And so going back to thinking about the episodes and as I was reminiscing about our conversations, it really struck me that I'm in a position typically to be talking to older adults, of course, folks in their 40s, 50s, or even older. And to talk with both of you, listening from your perspectives as young women, young adults in the Gen Z generation, I thought there's got to be something, lots that you were thinking about as you were going through your journeys in terms of your thoughts about the health system and your impressions. And I'd like to talk through that again and would love to have just the two of you even chat amongst yourselves also in terms of your thoughts and what what you experienced. But if someone asks both of you, we'll start off with this little exercise here. If you had to describe the healthcare system in one word, what word would you choose?
Well, I'd say that the first thing that comes to mind is unfortunately broken. And I feel like you hear that a lot throughout, social media, news stations, all of that, a lot of broken systems. However, I would try to use a different word in the sense of, and I don't know, there's probably somewhere that I could find, but broke trying to get better. And I feel like, not the entire healthcare system isn't broken. There are just bits and pieces that need work. And the people in the healthcare systems, I feel like a lot of them do try to make a positive impact. And so I think that there are some parts that are broken, but there are other parts that, are trying to fix those parts and, rectify certain mistakes. And so it's a very trying field. They're trying to be better.
Yeah. Yeah. Making some valiant efforts from your standpoint. Yeah. Emma, how about for you? What word would you use?
This is so hard for me to pick one word. The first word that came to my mind was unequal, and then I thought of like unaccessible. And I think just largely because of the work I've been doing lately, I've really seen kind of the gaps and how the healthcare system really puts certain people at an advantage and other people not. And I think a large part of that is just because like doctors are people as well, and they're not perfect and they have biases, but that bias often can contribute to mistreatment or maltreatment with patients in the healthcare system. And that's really where things get really messed up and very traumatizing for patients who need help and aren't able to access it the way that someone else might.
What's an example of what you researched recently or wrote about recently that gives you that impression?
Well, so yeah, something that I read about the other day was there's this program called the Bridge Access Program that was being funded and it no longer is. And it basically helps people who are uninsured have access to vaccines. And that funding is being ended. So those people that want to get a vaccine and are uninsured have to pay for it out of pocket. And that's really expensive. And then another article that I read was in the Oregonian about how people who are African American or Native American and have long COVID are more likely, like if they get COVID, to develop long COVID. And so many of them, because of biases within the healthcare system, don't get access to treatment or think that their condition can't be treated. And that's really, really messed up. I mean, it's racism is what it is. And I read about that article and it really stuck with me. And I know a lot of people who don't believe that there are barriers for people of color or women trying to gain access to treatment. And then I look at that and I'm like, how can you read this and still choose to be ignorant about it? I don't know. I just don't really understand that. But I don't know. I think because I'm empathetic, I read that, it upsets me. So
yeah. Any thoughts about that from your perspective, Olivia?
There is definitely a lot of bias out there and definitely racism within healthcare. And I'm on the tick-borne disease side. And one thing that, we say that the people who get this are the lucky ones is a bullseye rash. When you get bitten by a tick, 40% of those who do will get a rash that quite literally looks like a bullseye. However, a lot of people don't know that this rash can present differently, especially on different skin types. And so a lot of people who have darker skin colors, they present this rash differently. And it can be spotted, it could look like a bruise, it could look completely different. And I feel like already there is not enough training within healthcare providers to identify certain tick-borne illnesses unless you are in the East Coast, where it is stereotypically like one of the only places where tick-borne diseases exist. And that was a problem for me was, when they found out that I had Lyme disease after 51 doctors in 18 months, they said, well, that's weird because that's an East Coast thing. And they never thought that it could be in Denver or anywhere else for that matter. So I feel like there are a lot of biases and stigmas and stereotypes out there that are negatively impacting people, whether it's with long COVID and certain vaccines, tick-borne illnesses, or just in general. And I think that that definitely has to be changed. And a way to do that is better training, more awareness, and more information, and, just getting the word out that this exists and that there are ways that we can solve it and, provide awareness and provide information for these healthcare providers. Because sometimes, they are human. They don't necessarily mean to do this. It just might be rooted within the healthcare system to, stereotypically think that, oh, for example, this rash only presents as a giant red bullseye. You, sir, don't have it because you have darker skin and it's not presenting as a giant red bullseye. Sorry. So just breaking that stigma, those stereotypes, would be really helpful. So just bringing the awareness out there.
Mhm. Yeah. And both of you are very similar in that there's this quantitative factor of your experiences and your journeys. Olivia, with your 51 doctors in 18 months, and Emma had written an article for Medium, 10 doctors, 2 states, and 1 mystery illness, right? Did I get the
He was
text?
like one invisible illness, but I mean,
One
it's
invisible,
older.
yeah.
Yeah.
So
I mix them up sometimes.
that's okay. That's okay. But it's the point that again, being young adults going through a journey of chronic illness, and to have to quantify the number of providers that you've seen just to get to a point of feeling somewhat better. Or Olivia, you're in remission, and I know it took you a long time to find your doctor that specialized in Lyme. Are you still seeing him? Is he the one who provided the protocol for you?
Yes. So I was diagnosed with Lyme disease at 9 years old. I contracted it when I was 7 years old, and I didn't find this incredible doctor who I owe my life to until I was 12 years old. And so this medication and this treatment that he put me on, it was 42 pills a day for 9 weeks. And the main drug was Dapsone, which is a 100-year-old leprosy drug. And randomly, he found out that it has incredible effects on tick-borne diseases. However, a lot of people, they're like, oh my gosh, 42 pills a day, that's incredible. I went from 86 pills a day to 42 pills a day. So for me, that was cutting it in half. And already I was like, oh my gosh, this is fabulous. This is amazing. So yes, I still talk to that doctor often. I owe my life to him, and he makes sure that I can go to college and that, I will stay better, which is, great to have someone like that in my corner.
Yeah. Yeah. And Emma, you as well. Talk a little bit about your journey again, and the challenges that you had with physicians to get to someone who at least could give a name to your symptoms.
Yeah, so I mean, I got COVID for the first time in 2020 in Missoula, Montana when I was in college. And I developed the long COVID symptoms just a few months after that, which is pretty standard. It's about usually 3 months, like 6 weeks to 3 months, people develop symptoms if they have it. And I just kind of kept living my life because I could still work, and I was a climber and a skier, and I could do that. And I just had occasional weeks where I felt like I had the flu, which is known as post-exertional malaise. And it got really bad in spring of 2022, and I had already seen a few doctors at that point, and they all just, when I would explain my symptoms and how I was feeling, they would look at me like they were just bewildered, like I was crazy. They were like, "We don't know how to help you." And I thought, well, I don't know what's wrong with me. That's why I'm here. I'm 22. This is kind of your job to figure out as a doctor to try and brainstorm with me. And it got to a point where I couldn't work anymore because I was so sick. And I had conversation with my mom after she kind of heard how they were treating me, the doctors were treating me and refusing to test me for anything. And she said, I think it's time to come home. You need to come to a different state where there's better health care. And, I came home, I got COVID again, which made my symptoms worse. And I wasn't diagnosed until, February of last year. So I fought it for 3 years on my own, which was extremely mentally exhausting and terrifying. And I think for me, it's just been about, I didn't get diagnosed by a doctor. I read an article in the Washington Post about long COVID and chronic fatigue syndrome. And I thought, okay, it was explaining the symptoms. I thought that is exactly how I feel. And I've been trying to put words to my symptoms for the past 3 years, and I don't know how to explain it. And I didn't get into the long COVID clinic at the Oregon Health, and I forgot what it's, OHSU. I didn't get into that clinic until this fall. And even that hasn't been that helpful. I've had to do a lot of research on my own to figure out what medications work, because long COVID's so new, they still don't have medications out yet to help stabilize your symptoms. But luckily, I did get on one, and my symptoms are slowly improving, but they're still very much present. But yeah, it's been a really long journey, and I'm thankful to be feeling a little bit better. I'm not having crashes as often, and I have a job, which was a goal that I had. But yeah, I would not wish this upon anybody. And a large part of it is just long COVID's so new, and the healthcare system, as Olivia said, is broken. And I should have gotten diagnosed probably in 2021, but as a result of just people not educating themselves on my condition, I didn't until, 2023. So yeah.
Yeah, and your moms are both incredible. Just your advocate, your cheerleader, all of that. But and I know Olivia, for you, your symptoms started young, but for both of you, I feel that you found your voice and in some way felt that you could speak up for yourself during the course of seeing all these physicians. For both of you, what gets you to that point? Again, you're young, and usually, like all of us, we kind of lean on our parents to do the talking for us. But what got you both to a point where you felt like, I can talk for myself. I can stick up for myself. I need to advocate for myself with these physicians. How do you get to that point?
For me, those 18 months, I was so sick that I barely spoke at all. And so I was barely advocating for myself, and I didn't really realize that I needed to. I thought that, these are doctors. And, again, what Emma said, these are people who are paid to fix you and to make sure that everything is okay. And so that's what I assumed. And then it wasn't until, I was like, man, we're on Doctor 20, that I kind of started to realize maybe I do need to start talking for myself. Again, though, I was too sick. And so I felt like the first time where I realized, okay, I can do something about it, was actually the same moment where I realized how I can do that is maybe by starting a nonprofit of my own. It was because I had read a story about a mom and her son, and they were living in their car so they could afford the boy's Lyme disease medication, because only 28 days of doxycycline is insured out of all of the drugs for all tick-borne diseases, which there are at least 90. Only 1 month of medication that might or might not work depending on how early you saw the bite. That's the only thing that's insured. So when I read that, I realized, and I want to say I was like 12 years old, I realized, oh my gosh, I'm fortunate enough to where, my parents can afford my medication, and they were working super hard to make sure that, I was feeling okay, that I, could stay in school, that I was staying outside of hospitals. However, there are a lot of people and a lot of kids out there who can't. And knowing what it feels like when you can't stick up for yourself, I realized, okay, I have the room and I have the ability to stand up for myself. And that was the tipping point for me. It was that one story.
Emma, how about for you? At what point did you find your voice to speak up?
It was one specific appointment with the first neurologist I saw, that it was in the winter of last year, and I was so sick. I was leaving the house maybe once a week, and it was like I had to lay in bed for days on end to get to this appointment. And I had all these debilitating symptoms, and I mean, I feel like I was dying. I remember going to this appointment. At this point, I had basically lost everything that mattered to me. So a lot of my friends were not speaking to me. I had quit my job. I'd moved home. I was just like, I have nothing to lose at this point. Like I'm not myself. And I went to see this neurologist who, had like a 4-star review on my chart, had all of these, he just, had the credentials. And I remember seeing him and telling him all my symptoms. And I was so depressed and so just emotionally numb. And he looked at me, and he just, like, no emotion, no empathy, very robotic, just said to me, you know, all your muscle twitching, your numbness, your tingling, your migraines, your fatigue, your heart palpitations, they're all linked to your anxiety and depression. And I sat there and I thought, that's just not true. There's no way that that is all related to my mental health. And I knew that in that moment, it didn't matter what I said to him. Nothing that I was going to say was going to make him feel like he should test me for something different. He wasn't going to refer me to anybody else. He was just going to keep me in this loop of just isolation. He wasn't going to help me. And he didn't care. He thought I was crazy. Or he did know what was wrong with me, that I had long COVID, and he didn't tell me for whatever reason if he knew that I had it. And it's just so abusive and horrible. And I just I was like, you know what? I don't care. I'm not getting anywhere with him. I'm not going to deal with this. I have the right to walk away from someone who's treating me like this, who makes me feel stupid and inferior and is doing this because he doesn't want to admit that he has no idea what's wrong with me, because that would acknowledge that he doesn't know what he's doing, you know? So clearly I have anger about this. But yeah, after that appointment, I just said, you know what? I'm busting my butt to get here to be told by every doctor that I'm overly emotional and crazy and not sick when I am sick. So I don't care. And I just kind of was like, I'm going to start advocating for myself. And my first step with that is getting a new doctor, because I'm not putting up with this anymore.
And Olivia, you said something similar in that you felt that maybe your opinions weren't valued by the physicians because you were too young.
Absolutely. I thought that, looking back on it, that's exactly what they thought. I mean, I'm an 8-year-old kid and they can't figure out what's wrong with me. And, at first they were like, oh, we're at a high altitude state. You got to drink water. Oh, everyone in Colorado, you got to drink water. Because I came in and I was, passing out. I was losing my vision. And they were like, you're just
I don't mean to laugh, Olivia,
super
but
dehydrated.
I think, Emma, didn't you say in your interview that didn't they tell you needed to drink more water too for something?
Yeah, for my POTS, they
Yeah.
said drink more water, take sugar and caffeine out of your diet. And I was like, that is what you're supposed to do, but it's a little bit more complicated than that. And they didn't even really know that I officially have POTS.
Yeah.
I do have POTS though, so.
Me too. That's so interesting. But yeah, these doctors, they didn't value my opinion because I was too young, and they misdiagnosed me with everything under the sun. It felt like they were thinking of certain types of cancers. They thought that I had late-stage autism. They thought that I had Wilson's disease and gave my parents a pamphlet on what to do because your child's going to die probably around 20 years old. And they sat me down and they were like, you're not going to live a long life like your classmates will. And I was like, wow, I'm 8 years old and you're telling me that like my time here is so much more shorter than everyone else. I was like, that's incredible. Test came back and it was negative. They then, diagnosed me and my mom with Munchausen syndrome, which is the illness of faking illness for attention. And so that's when they started asking me the questions of, do you think your parents love your brothers more than they love you? Do you have friends at school? Are you happy? And, I'm sure that I don't even remember, but I'm sure that they sent me to, a couple psychiatrists. And that's when my mom and I realized, oh my gosh, like they have no idea what they're talking about. We were like, oh my goodness, at first we were like, oh, well, maybe it's just really hard to diagnose, whatever. No, they have no clue what they're talking about. It's not hard to diagnose. My 51st doctor, which was also my first female doctor that I had seen in that entire children's hospital, she said, wow, your symptoms look really similar to a patient that I had a couple months ago who ended up having Lyme disease. I'm just going to do a random test. And I was off the charts and completely off the chart. And that's all it took. And it wasn't anything super difficult. It was just a blood test.
Wow. What kind of physician was she? What was her specialty?
Oh gosh, honestly, I know her name's Dr. Hamilton, and I was so young that truthfully I don't remember. I know that she's incredible though. And she truthfully was another turning point in my life to where at least I had a name to put to it. However, she got me so far, but then it took another few years to figure out that I also have Bartonella, Babesia, POTS syndrome, relapsing fever, and an anti-1 trypsin deficiency in my liver, which at that point, 53 doctors had all missed.
Wow.
So that was a really tough time. And a lot of those doctors, yeah, they did not care about my opinion at all. They thought that I was just some 8-year-old who couldn't, speak for themselves and was having, certain issues and then was faking it. So that's my story for them.
Yeah, and Emma, and I think Olivia, you alluded to this too. Emma, for you, it's all very emotional for both of you to have to go through all of this with your families, etc. But you had said in your episode that it was very emotional for you to get to a doctor who came out and said, how are you doing? How have you been going through this? This must be terrible for you. A doctor that had empathy. Um, why was that so emotional for you and perhaps for you too, Olivia?
Yeah, so my new primary care provider who I started seeing this past fall, before my first appointment with her, like my initial just, kind of like, nice to meet you. Uh, uh, I had called the clinic and just said like, hey, I have long COVID. If she wouldn't mind wearing a mask, I'd really appreciate it. And so she came in, had a mask on. She's like, so I hear you have long COVID. And I said, yes, I do have it. And I started explaining my symptoms to her, and she was typing on the computer and she stopped and she turned around in her chair and she looked at me and her eyes were super wide and her face, like she's wearing a mask, but I tell her face was just like, you know, emotional. And she looked at me and she said, are you okay? And I said, um, I mean, it is what it is. And it was the first time I'd ever had a doctor since like I started seeing doctors in 2022 actually say like, are you depressed? Like, are you having suicidal ideation? Like, this is very physical. I understand that. Like, this is a physical disease, but like, how is your mental health? Can we, try medication just to try and lift your mood up a little bit? Like, what can you do that makes you happy? And I was so used to just being treated kind of as Olivia talked about as a clipboard. And okay, yeah, like you have this disease, but like, be tough, like you're fine. It's like, like as a 20-year-old losing your career and all of your bees, like how much grief that is and and like I was so sick, like I couldn't really leave the house very much. Like that's not a normal thing for a human being to go through. Of course you're going to be depressed. And she was the first doctor who ever kind of made me feel like I was just being a normal person for experiencing grief and like it wasn't me being overly dramatic. And so many of the other doctors, and I don't know if they meant to do this, but just their tone and their body language and the way they talked to me was kind of like, you're being sensitive for feeling grief about the experience that you're having. Like, this is normal, kind of like grow up, this is part of life was kind of their mentality, or just ignoring it altogether, which like, I mean, that's just so simple to treat someone like that. And I still don't really understand it. And I think a lot of it is just doctors get into this habit of kind of being robotic, and it's, they get into a rhythm of it's like appointment, appointment, they do it over and over. But you have to remember that like this person has feelings and trauma usually, and especially if they have a chronic condition, got to keep that in mind. And I don't know, it's really messed up.
Olivia, any thoughts around that?
Yes. I think that, going off the roboticness of doctors is, I feel like sometimes they view us as like a math problem and we're just really hard math problems. But you also have to realize that we're math problems with feelings with emotions and we can get sad. And so it's not as simple. And also, sometimes these doctors, they can't figure out those math problems and then they get frustrated and then they leave. So, looking at it in a different way, I understand probably, having this whole career where you are supposed to fix everyone and then meeting a person where you can't figure it out. And I understand that that's probably super frustrating, but imagine what they're going through. And so I feel like for doctors and whoever may be listening to this episode right now, it's really important to, realize that empathy is a very, very big part of healthcare. And they may not have, courses specifically designed for empathy in whatever med school you go to. And maybe they do, but it's really important to, maintain that humanity and not just look at us like clipboards. And so for me, one of those experiences where someone looked at me like a person was actually my current doctor, Dr. Richard Horowitz, who I think is the godfather of Lyme disease and who I owe my life to. And he got me into an appointment and he told me and my mom and my dad, he was like, bring snacks. And we were so confused. We were like, why do we need to bring snacks? Really weird. Like, okay, whatever. So we like brought or something. He sat down and went through my entire medical record page by page, which at that point was about the size of my head. It was like insanely huge. And I had like 2 of them. So many pages. And he would flip through every single one and he would sign off on it that he had read it. And he was going through them and he would pause and he would say, they did what? They tested you for what? Why would they do that? And then when he got to the point of, I believe I had a copper test or something. And I think my copper was really low. And he was like, had they known to do this, it would have saved you 3 months. And then he just kept on going like that for the rest of the appointment. And then finally we got to the Munchausen syndrome diagnosis. And he quite literally banged his head on the wall. This doctor, he walked on over, banged his head on the wall. He was like, I am so sorry that these people couldn't figure out something that they should have figured out a long time ago. And having that experience where he spent 6 hours combing through every single page, signing off on every single page, explaining every single test, diagnosis, misdiagnosis, everything, and then doing his own diagnosis on me and doing another set of tests and questionnaires and all of these incredible things. I was like, wow, this person cares. And he not only wants to, make me feel better, but he wants me to, also realize that I have worth and that I'm not just a clipboard and that I'm not just a stack of medical papers. And for him to explain everything to me, a 12-year-old at that point, and to not look at me and go, oh, you're 12, you don't need to know about this, you won't understand. He never once said, oh, I'm going to talk to your mom and not you because you won't understand. And there were, of course, times where I didn't understand what he was talking about at all, but it felt so nice to be included in my own medical diagnosis, my own medical health. And so that was a really, really amazing time for me. And that, gave me hope in this healthcare system that, there are some parts that are definitely broken, but then there's other parts like Dr. Richard Horowitz, who he's trying to fix those broken parts.
Yeah, that's incredible. And Emma, you're chuckling, and I have a feeling I know why, because I think you had said that you had some testing done where you just felt like, well, why didn't they do that in the beginning? Why did I have to wait so long to get this test done? Am I close?
I just love that he said bring snacks. I think that's hilarious. I definitely went through that, I think, when I had low B12 because I was just so fatigued, and I saw a primary care provider in Missoula, and she just kept trying to push Lexapro on me, which for some people that is the answer and that's what they need, but for me it would not have worked. And and then I ended up in the emergency room because my symptoms were so debilitating, and I had 4 ER doctors who looked at me like I was like just psychotic. I was having a panic attack because I was having sensations around my brain, and it was terrifying, understandably so. And they asked me, like, are you pregnant? Have you been drinking? And I'm like, I'm not pregnant. I had 1 beer today because I had friends over and they accused me of being an alcoholic. And I said, I'm so fatigued. Please help me. And none of them ran any blood tests. They just put me on an anti-anxiety and told me to go see a psychiatrist. And then, I moved home, and the first doctor I saw when I came back into Oregon, I said, I'm so fatigued all the time. I feel terrible. And I was so numb and just angry at this point, and I felt so helpless that I just kind of sat there and I was like prepared for her to just gaslight me. And instead she said, um, I'm not a fan of telling people that they're depressed when they're actually really, really sick. And she ran 2 tests. One was B12 and one was for pernicious anemia, which is the autoimmune condition where your body doesn't make intrinsic factors, so you can't absorb B12. And my B12 was in the low hundreds. And I got that phone call a week later about my B12, and I was so overwhelmed with I was right and what the heck? Why did nobody catch this? This is not a rare thing. B12 is not unheard of. What the heck? Like, did they just not believe me? Oh, yes, they didn't believe me. Or it's just, I don't know. It's astounding. And then when I got into the long COVID clinic, I'd asked the first neurologist in the fall to have a tilt table test at OHSU to test for POTS and other symptoms. And he said, you don't need that. And then when I got into OHSU, the provider that I saw looked at my chart and said, have you been tested at OHSU with the tilt table test for POTS? I said, no, they told me I didn't need that. And he goes, I just agree. You definitely need that. And you need an ultrasound of your heart to check for damage. I was sitting at the computer and I thought, okay, so I was right. Interesting. This keeps happening. Yeah, and when my mom came home, I was so emotional. I was crying, and she said, what happened? And I told her, and she goes, the medical system is broken, and I'm so sorry this has happened to you. But she's also my mom, so she was really angry, like, no one listened to you. What the heck? So I definitely relate to that. It's just like the answer is sitting in front of them, and they don't want to pursue it. I don't really get it.
Yeah. Emma, you use the term gaslighting. What does gaslighting mean to the two of you?
You want to go first?
Sure. For me, gaslighting, I feel like so many doctors, they do that, whether they, mean to or not, because, doctors, they want to be right. And a lot of people, they might not like those answers. Or in my situation, my mom and I were like, that's kind of BS. We were like, we don't think that's actually the case. And they would say, typical occasions where you need to drink more water. The issue is water. And then when I try and say, but I'm passing out all the time and I drink a lot of water. No, the issue is water. And then especially as a kid, I feel like you don't understand what gaslighting is. So I'm feeling bad about not drinking enough water. And I'm thinking that I have to, drown myself from the inside out and everything will be fine. And then, of course, every misdiagnosis later, I was feeling bad because it was something wrong with me, something that I wasn't doing correctly. And then again with Munchausen syndrome, I started thinking, I was like, man, am I really making this up? I was like, and so I started to go back in my head and I was like, did I fall on the floor on purpose? Did I go blind on purpose? And, eventually you have to realize there's no way for you to be able to go blind on purpose like that and, fall down a flight of stairs. I don't think a lot of people do that on purpose. And I was like, wow, they're really trying to drive that into me that I am the problem and that I am unfixable, I am unsolvable. And so for me, gaslighting happens everywhere. And even non-medical and healthcare system with certain politicians and activism, for the longest time. And even now I'm 19, but when I started my nonprofit at 12 years old, I was always the youngest person in the room. I didn't graduate at that point, middle school, high school, college. I didn't have a PhD or any MBA and diploma, anything. I was just a kid with a nonprofit who had something to say. And I feel like a lot of adults, they looked down on me and they were like, wow, whose daughter is this? This is not a bring your kid to work day. And then they would all be surprised when I was the one giving the keynote speech. I was the one that beat them with the HHS Opportunity Project and presented at the White House because apparently a 12-year-old can make a better app than Oracle or IBM.
That's some girl power right there. Yeah.
And so lots of gaslighting, but I will tell you, it is so satisfying to prove those people wrong and to prove that you are more than just a sick kid who's sensitive and who doesn't know what they're talking about. So for me, gaslighting, it's a lot, but if you can handle it, it is honestly a little bit fun to deal with because you get to watch them rethink their views and hopefully they change. So that's what gaslighting has been for me.
Yeah. And for all those people, you can tell them to stick it. I'll be nice and say it that way because you spend a lot of time on the Hill, don't you?
Yes, I do. I spend a lot of time on the Hill. Actually, I was just there a couple weeks ago. There's a new vector-borne disease strategy that I was invited to go to and sit at the round table for. And so lots of CDC trips, lots of, on the Hill, Senate, Congress, White House, all of that. And it's been really incredible. And I'm so glad that that's what I get to do. And that's where I've gotten so far because I know that when I'm there and when I'm talking to those senators and congressmen and women, there are changes actually being made. And it's not just, I think at first a lot of them, they let me in. I always send them an email. People always ask, how do you get into how these meetings? And I sent them an email. I said, hi, my name's Olivia Goodrow. I'm 12 years old. I'm the owner of this nonprofit. And I would love to talk to you. And they always say yes. I think because they're like, oh, cute, a 12-year-old. Like, what are they going to talk about? Like funding the next school project, the science fair. And, I come in, I'm like, boom, facts. I'm like, all of this stuff. I'm like, we need more funding. Here's where it can go to. And, I just, hit them with all these, very adult topics. And I think they're like, oh, if a 12-year-old has to come to us about this, maybe we should be paying attention. So it's been really great getting to do that.
Yeah, no, that's very cool. See, Emma, what you have to look forward to with your nonprofit and speaking your truth, potentially up on the Hill yourself.
I was imagining trying to advocate for long COVID on the Hill, and that sounds really, really, I don't know how I would do that. I think I need to I need to prepare for that though, because that's kind of ultimately, and I mean, I see that all the time right now on social media because I follow the Sick Times, which is a paper dedicated to covering the long COVID crisis, and I see people advocating for antivirals on, on the Hill, and I'm like, yeah, that's kind of what we need because there's a lot of people suffering, and there's just not. I mean, I think part of the problem is, one facet of long COVID is chronic fatigue syndrome, and there's a history of people with chronic fatigue syndrome being ignored, and there's just no treatment for it. And there still isn't. There are people that have been, suffering for 10, 15, 20, 30 years with this disease. And I think long COVID really put, POTS and chronic fatigue syndrome and brought it to the surface and kind of dropped the veil. And so now people don't really have an excuse to ignore it unless they just don't want to deal with it because, like Olivia talked about, it's a really complicated math problem that a lot of people are not going to find the answer to. But, if they're not listening to you, you show up on their doorstep, which is what people are doing in DC right now. And I think it's really spectacular. And yeah, if someone invited me there to talk, I would 100% fly there and, tell my story and pass my article out and say, do something because it's unacceptable. And I know way more than I should about all of this because of what I've been through. And I did want to touch on just gaslighting because I didn't even know what it was until I went through all of this. And I think one specific thing I remember so vividly is, before I got sick with COVID, I was an athlete. I was a sub 6 mile runner. I was a climber, skier, did a climbing gym for 2 years. And I just remember, trying to go on walks every day last year when I could. I mean, I felt horrible. And I would be going around my neighborhood and I would just get hit with like dizziness, muscle weakness. Just I felt like my like I could feel gravity is kind of how I would describe it. It's just pulling me down. And because of how I'd been treated and what I'd been told by, healthcare providers and doctors was I just would tell myself, Emma, you're too in your head. This is just depression. You need to try harder. Like just gaslighting myself and being so mean to myself because that's what I had been told was acceptable and that was a diagnosis. And I'm looking back and I'm thinking, oh my God, no, I had chronic fatigue syndrome. I still do. I mean, I'm starting to go on walks every day and I don't feel as awful, which is a huge blessing. But that's what gaslighting does to you. It makes you question your reality. And then you start to think, am I doing this to myself? Like, like, are my muscles really, is this weakness or am I just like being dramatic? I don't know. Am I making my own heart skip a beat? Am I, you just, you feel crazy and like can't trust your own feelings or your instincts. And it's taken me a long, long time to bring my self-esteem and just heal from all of this because it was so traumatizing. And, I did end up having to going to a crisis center to talk to somebody because I was just so depressed. And I thought no one's going to ever give me an answer or a solution. And I don't want to be here anymore. Like, this is so debilitating. And it got better. So, no matter how horrible things feel, they do get better. And it might take a long time, but it's always important to stick around because there's just, suffering is not forever. So I just want to get that message across. But gaslighting is absolutely unacceptable. And just because you can't figure out the answer to the problem doesn't mean there's not a solution.
So, with all of that, and again, thinking about a younger person's perspective, and for you, Olivia, you started in the healthcare system as what would be considered a pediatric patient. And then when you're 18, you age out, as they say, and now you're in the world of adult medicine. But from both of your perspectives, Olivia being 19 and Emma being 26, what should the healthcare system, physicians, and other providers be keeping in mind for people your age who are dealing with chronic illness? What do you think is unique, and what does your generation need from a healthcare standpoint?
Um, well, I mean, there's obviously a huge difference between having a chronic illness and having an illness that, isn't chronic. I mean, there's a huge difference between, having chronic fatigue and then having the flu one week. And I feel like doctors need to recognize that, chronic illnesses, as much as we would love for you guys to solve it in a day, and that's their mentality, it normally is not the case with the chronic illness. And it comes in waves. There are days where it's good, there are days where it's bad, and there are days where it's a lot worse than anything. And I feel like doctors have to realize that, okay, I can't solve this in a day. That's okay. That's normal. I should not be frustrated and give up on this person because I can't solve it in a day. I think doctors should realize how important consistency is. I think that, that consistent level of attention and care and, quality of work. I mean, that's why I love my current doctor, is because he was consistent with how he viewed me as a person. And every time I saw him, it wasn't like, the first time that's how he lures you in. And then the next time it's, oh, you're just a number. Goodbye. It was, consistently, he was like, how are you doing? How are you feeling? What can we do to make you better? And I feel like, also having certain markers and having, certain ways to track a chronic illness, which is why I started the long haul tracker, was because, if you asked me a week ago how my migrating muscle aches were and where they were specifically last week, I would say, I don't know. They were everywhere. I couldn't tell you specifically when. And so with my app, it helps you track that. It helps you keep track of that. And then you can send it to healthcare providers.
Well, and
So
Olivia, I know you have the tick tracker, but what's the name of this app? Is this new?
yeah, absolutely. This is the long haul tracker, and it is free and in multiple languages, and you can download it on iOS and the App Store and everything, and Android and everything. But more or less, it helps patients and caregivers track symptoms, and it makes it easily easily visible because we use graphs. So for me, being able to see my progress would have been great as a kid, because those 18 months, I was like, oh my gosh, am I getting worse? Am I getting better? Am I staying the same? And a lot of doctors would ask you that, and I wouldn't be able to give them a clear answer. So being able to actually have that on a graph and, see the line graph and say, okay, I did good this month and then something happened this month. Maybe I had a surgery, something like that. And it also helps you track your symptoms. And so every day, if you want, or however often you want to, keep updating this, you can have a list of symptoms from any range of symptoms from any disease. So it's not limited to just tick-borne illnesses. You can do anything from COVID to celiac disease to type 2 diabetes, anything. And I did this specifically because there are a lot of invisible illnesses, rare illnesses out there, and I didn't want to, marginalize those groups any further. But this app, I feel, is really beneficial to making sure that, patients are accurately, having this catalog and having this, not, I wouldn't say even journal, it's a whole database of their whole medical history to where, when one doctor says, oh, well, you were doing fine last week, or, you were doing better last week, you could say, actually, no, I wasn't. Here you go. And you can kind of pull up that data, because normally I feel like, yes, they look at me as a clipboard. I don't even have access to that clipboard. I have no idea where that clipboard is, but that's what they view me as. So that is a brand new app, and it's been really beneficial for a lot of people. And a lot of studies are using it for, certain test groups, and being able to, consistently track and report what's going on in people's bodies, because everyone is different. So that is my app. And so I feel like, again, going back to consistency is great with a chronic illness, because chronic illnesses are consistent, sometimes persistent, all the time, and really need to, keep up with that and just make sure that, we're not treating this like something that's like a head cold that can be, fixed within a week. And, there has to be a lot of training and, again, a lot of awareness. There's a whole laundry list of things that can be better with a chronic illness. But I would say consistency, and also recognizing the difference between a chronic illness and, something that might last only a week or so, is very important for healthcare providers.
Sure. Yeah. So doctors certainly can present a solution for something more acute, like you said, a flu, or, something short term versus chronic. And the app is interesting, I would think, especially for parents too, where we know a lot of times chronic illnesses run in families as well. So to be able to help parents keep track of kids' symptoms, and because sometimes kids go to the same doctor for whatever the maybe genetic disorder is or something like that. So yeah, just to help have that as a tool to have a conversation with physicians, because I think a lot of times, and I've heard this from older folks that I've talked with or have interviewed, where they feel prior to their appointment with their doctors, they feel very prepared, but there's something about getting into the exam room that something happens, and now all of a sudden you are nervous and have forgotten everything that you needed to say, or you only had a couple minutes with the doctor, things like that. So having that conversation, the dynamics kind of change before you get there, and then when you're there, and then you walk away saying, oh my gosh, I should have asked this and this. So that app is really amazing, Olivia.
Yeah, absolutely. And one other thing really quickly is that you can share your data with healthcare providers, and you can also share it with studies being conducted too. So it makes you, I guess, feel good in a sense that, there's a section saying, hey, if you have this specific illness and you're from whatever age to whatever age, or, you meet the requirements of these studies that are being advertised on the app, you can enroll in those studies. And so I feel like, as a patient who, they might not know necessarily what's going on, and they might want a second opinion, or, they might just want to get their symptoms out there, enrolling in a study while also sharing it to your healthcare providers and family members is really, really beneficial, because it helps you get your health out there to where someone can say, you were in this study, and we concluded that a majority of people who experience these symptoms often had this illness correlated with them. might want to look into that. So I feel like it opens up a world of opportunity for people who, have chronic illness.
Yeah, definitely. And Emma, for you, what do you think physicians and healthcare providers need to know again about your generation? What are some of those maybe unique needs or things that they just need to consider when managing folks in your age range, managing a chronic illness?
Yeah, so I mean, I think Olivia did a good job of mentioning this, but consistency is really important. When I saw my new PCP this fall, the first thing she said to me, because it was, it's like a 15 to 20-minute appointment. You can't talk about everything you should talk about. She said, okay, I want to make a follow-up with you in 2 weeks, and I want to touch base on, what we talked about. And then when I saw her again, she said, okay, I want to see you again in 2 weeks to do another follow-up and really dial all this down. And I remember thinking like, whoa, she cares and she's gonna put effort into trying to understand this. And then something else that she did was she researched and tried to figure out, what in her tool belt could she give to help me. So we talked about different medications, like people that have really bad brain fog. Sometimes taking a small dose of Adderall actually helps them focus more and activates that. And so she was talking about that, and she was researching on her own time. She was open to learning about something that she didn't understand. I think that's another thing. Like when doctors are greeted with this, math problem that they're confused on how to solve, it's okay, let's look outside the box and research, maybe even on my own time, to try and help this person just feel a little bit better or just not feel so helpless and lost on their condition. And, yeah, that requires effort and admitting that you don't know how to help them. But I think in a way that's almost more brave and admirable to do that on your own time versus just ignoring them or gaslighting them. And I get that that can be really vulnerable and difficult to admit that you don't know, exactly how to help them because that's your job is to help them. But you're gonna end up helping them in the long run by doing that and make them feel less helpless. So I would just say be open to learning, practice empathy. I've never had someone practice empathy and been like icked out by it. Empathy is really important. And then, yeah, just consistency and chronic conditions, they're called chronic for a reason. Either buckle up and help the patient or refer them to someone else who's going to help them and wants to stick out the ride with them. I think that's really important.
Yeah. Yeah. Awesome. And outside of treatment of chronic conditions, again, thinking about people your age, what would you have liked to have had access to, maybe from a support standpoint? So like you, Olivia, you brought to the world Liveline Foundation, but for yourself while you were going through it for both of you, what, you go to the doctor, you hear what the doctor has to say. It was either here's a medication, drink more water, whatever it is from a treatment plan standpoint, that's one thing. But what about when you get home? What would you have liked from a support standpoint?
Um, and I feel like with my case specifically, it's hard to ask this of young children. I feel like what I would have really appreciated was more openness and more, acceptance of differences. And, for young kids, they might not understand that yet. They might not understand the consequences. At that point, when you're 8 years old and in second grade is like your entire life. Like, that's where all of your friends are. That's where everything is. And for someone to be outside of that little bubble, that little box, it's different. And I feel like for, a lot of those kids, there were probably times where it was maybe scary. And that could be a reason why, they didn't like think to reach out to me. They thought that I was different. They thought that I was weird, that I was, contagious in some ways because, they're young and they don't know yet these differences and implications. And especially the middle school that I went to, a lot of the people there had very similar backgrounds and, probably played a sport after school, probably lived in the same area. And so it wasn't a very, good place for openness and diversity of walks through life because again, you're in second grade, you don't understand that yet. But I feel like for me going through that again, of course, I would love for there to be a cure ready at any disposable place. And I would have loved for there to be a test that, everyone knows how to use. It's super easy, super quick. I would love those things. I think that, for support though outside of the healthcare system, definitely openness from other people. And, I wrote my book, But She Looks Fine From Illness to Activism. And that's the title, But She Looks Fine. Because a majority of people, when I told them that I was sick, they would look at me and look at me up and down and they would say, no, but you look fine. You look fine. Like, I don't see anything wrong with you. And that's like the price to pay with an invisible illness. If Lyme disease had like warts and chicken pox every time and, you got stripes and you turned different colors, maybe there would be a difference. But unfortunately, that's not the case. So I feel like just acceptance and openness and, as Emma said, a willingness to learn something different and also to, in some ways, admit that you are wrong about, previous conceptions and interpretations of someone.
Yeah. Do either of you feel that there's a need for, and I don't even know if people at your age would even participate, but and everything of course is virtual now, whatever, but that there'd be either a physical space or some kind of virtual forum that you think people your age or your generation would participate in, some kind of virtual forum, if you will, for young kids and again, Gen Z to convene and talk about chronic illness? Do folks your age talk about things like that? Maybe that's the bigger question. Like if you had 50 Gen Zs in a room who all had some type of chronic illness, do you think that there'd be an exchange among all of you to talk about your illnesses? Is that helpful? I'm trying to see where else change can happen in the healthcare system.
Well, and I don't even think like I'm thinking about this is one of the positive and the silver linings about this whole thing too, is like I've connected with so many people across the country because of and I don't love social media, but because of social media, I've gotten in contact with so many people, and not just like people Gen Z, but like I talked to a woman in her 30s like a couple of weeks ago who she was like driving through Texas, and I think she's in her 30s. Anyways, but she was a millennial, and she was like, "How are you doing? This is what I've tried. It's helped me. Have you tried it?" And I was like, "I've tried everything, yes." But just relating to her in some sense. And yeah, I mean, I think one of the really admirable things about our generation and I like we are so open to talking about things that I think no offense to my parents' generation, but my parents' generation keeps very quiet. Like they don't want to talk about their problems, and our generation shouts it out into the void, which I actually really admire because it starts that conversation and people get help versus just holding it all in. Obviously I don't know. I'm a little bit more of a private person, so I don't love doing that, but I I think the thing that I wish I had had sooner was I don't know why nobody mentioned to me a support group for long haulers. That's totally a thing, and no one ever thought to refer me to one of those. My therapist actually, because I came out of a crash and came out of post-exertional malaise crash, she found a long COVID support group for me, and it actually really helped me confirm my diagnosis. And it was the first time meeting other people with long COVID, which is out there. So that was really interesting. But I 1,000% think that people 20s and their 30s and early 40s even we all relate to each other when you have a chronic condition, even if it's not long COVID, it's Lyme disease or Ehlers, there's a sense to relate and connect no matter your age range. I think that's a really powerful thing, maybe not under the best circumstances because of what we're dealing with, but it helps to make people feel less alone. Just kind of everything that humans strive for is connection. So
Yeah. Any final thoughts there, Olivia, for you?
Yeah, I mean, well, the whole reason why I started my nonprofit and everything that I'm doing now was because I had went onto my mom's Facebook page and I had looked up people with Lyme disease and kids with Lyme disease. And that was the whole reason why. And, there are tons of forums and groups out there to where it's all of these patients. And especially there are a ton of forums and groups with moms. And so it was very nice to know that, I'm not only finding people to connect with, but my poor mother is, who's had to deal with a child being sick and everyone telling her and her child that they're wrong and that they're the problem. And so I am really happy that, these forums and groups exist. I think that, there are good and bad things to both of them. I feel like, being in the Lyme disease community, it's been great so far. I love everyone there. Everyone wants the same goal, whether they might disagree with some things or not. They all want to feel better and they all want everyone else to feel better, which is great. However, with certain, we were talking about this a while ago, but with a new vaccine coming out from Pfizer, a Lyme disease vaccine, it's a prophylactic vaccine. How they're advertising it is for people who don't want to get Lyme disease, which is great. We do not want anyone else to get Lyme disease and other tick-borne illnesses. However, it further divides the group that does have Lyme disease. And so there are certain pros and cons with, these groups is that you can also feel like then you're categorized. Oh, you're the one who's sick. You go with the other sick kids and you go talk about all of your sickness and stuff. So I think that if you understand how to balance those forums and groups and then, also connect with other people who aren't sick and, educate them and, surround yourself with a variety of people, I think that can be really, really beneficial. And I feel like same goes for other people out there who aren't sick with anything and who are the epitome of health. It would be great for them to surround themselves with people who are sick with some things, aren't with others. And so I think, variety and openness is really key to maintaining, I guess, a positive space, whether you are sick, not sick, boy, girl, pink hair, blue hair, whatever you got to do. So I think that as long as you just keep yourself open, that's really good.
Well, ladies, this has been a fantastic conversation, and I am so lucky to be graced by such articulate, intelligent young women, and I'm looking forward to what trajectory you gals take in the future. Emma, all the best to you in the new job, and keep on progressing and keep pushing along and getting better, and you'll be climbing the tallest of rocks, I'm sure, soon enough. And Olivia, it's so nice to see you again, and so thrilled to hear about your new app and that you're loving school. Your freshman year was amazing, and I'm sure we'll see you in Congress one of these days, representing some state somewhere, probably just killing it. So I want to thank you both. As my dad would say, go knock 'em dead. And I'm really proud of both of you. I feel like the two of you are like my little sisters. So since we're like 2 generations removed, actually you're old enough to be my daughters, but that's a whole nother episode. But I want to thank both of you for being with me during this episode. And thank you everyone for listening. I'm Laura Nozicka, host of the Desperate for a Diagnosis podcast. Stay well and keep pushing for answers. Oh my goodness, that's a wrap on another compelling story. Thanks for listening to the Desperate for a Diagnosis podcast. If you would like more information about today's guests or to find out more about Laura, me, go to desperateforadiagnosis.com. If you enjoyed the show, please subscribe, rate, and review the podcast on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. You can also follow show updates and healthcare news on the podcast's Facebook page. If you would like to be a guest on the show, or if you have any questions, advice, or suggestions for our guests, please email me at lauramarie@desperateforadiagnosis.com.